I first found out I was pregnant when I was entering my sophomore year of college. I broke the news to my family and they weren't very pleased, and actually my child's father, he wasn't pleased also. So we ended breaking off the relationship and I ended up having to move away from home.
Of course, I was pregnant with triplets, about to be a single mother. I was very scared, didn't know what I was going to do, didn't have many resources, and tried to contact as many as I could on my own with failure.
You know, things were kind of shaky once I found out I was pregnant.
An unplanned pregnancy. It's been said that women who are experiencing an unplanned pregnancy also deserve unplanned joy. Yet it might be hard to envision that joy when a pregnancy is seen as an interruption of other plans. High school, college, a career. Or when a pregnant woman or teen has no money, no place to live, no job skills, no access to prenatal care, no parenting skills, no support network, or is addicted to drugs or alcohol. The choices might seem pretty bleak, but that's where an alternative to abortion services program such as Catholic Charities, the Gabriel Network, or a pregnancy resource center can help. Help meet the needs of a pregnant woman where she is, without judgment or strings attached.
Abortion should never have to be the only choice. We have agencies, we have individuals who are more than willing to help a woman through a crisis pregnancy, to give new life to her and to her child, and to be specific in each case. Each case is different, but our Catholic Church is intent on bringing pregnancies to life and on helping anyone who sees the only alternative to be abortion to see otherwise.
No one should feel forced to choose abortion because of a lack of financial support. As a society, abortion shouldn't be the best we can do when a woman is pregnant and in need of assistance. She deserves to have support and services provided to her to help her see that she does have choices, that she can bear a child and still fulfill her dreams, whatever they may be. In Maryland, many nonprofits are providing abortion alternative services to women free of charge. With the limited funds they obtain from private donors and fundraising, they serve as many clients as they can. But Maryland nonprofits don't have the capacity to serve every pregnant woman in need. Many service providers are only open limited hours, and some areas of the state don't have the providers they need to put help within easy reach of every Maryland woman who is in turmoil because of an unexpected pregnancy.
3 years ago, the Center for Pregnancy Concerns had 3 centers. Our donations dropped to a degree and we had to close 2 centers. This was strictly due to the fact that our budget dropped substantially, and it was devastating to the community to have the fear that we might not be available to all these thousands of women that we deal with every year.
And what I really needed at the time, in addition to the basics, was just a helping hand, a hand up, not a hand out. And they provided me with that, and I was very grateful.
The Catholic charity services to pregnant women are primarily social services, meaning that we recognize that the pregnancy may just be one issue in the woman's life, and we realize that there are a lot of other issues impinging on her that will affect her pregnancy. Those may be economic, educational, mental health issues, and our job is to coordinate the services to her among all those needs. So we will coordinate with psychiatrists, psychologists, government offices, anything that we can to improve the quality of life of the woman and ultimately her child.
Maryland Pregnancy Resource Centers serve more than 30,000 women annually and provide specialized counseling to women who are uniquely vulnerable. They avoid duplication of services available elsewhere through an active referral program that steers women to government agencies when needed, agencies that might not otherwise be easy to find or access.
We meet the needs of the women that come into our center through various referrals. We have referrals for housing, for jobs, for medical help, professional counseling, and various other needs. There are various agencies throughout the city of Baltimore that provide this information, and we refer our clients to those agencies.
These life-affirming nonprofit organizations focus on providing one-on-one support. The uniqueness of the services they provide is affirmed by the government agencies that refer clients to the nonprofit organizations.
Typically, I meet clients at their homes. There, I'll do a written assessment, finding out what her needs are. One of the things that I do assist her with primarily is to hook her up with a primary care provider or prenatal doctor, someone that she can go to receive medical attention.
Speaking as a prenatal nurse, I'd like to share with you the importance of prenatal care. All mothers-to-be benefit from prenatal care. Women who see a health care provider during pregnancy have healthier babies, are less likely to deliver prematurely, and are less likely to have other serious problems related to pregnancy. Pregnancy centers are so important because they identify women that are at risk and they help get women into prenatal care as soon as possible.
The difference between long-term success and failure for women dealing with an unexpected pregnancy can depend on being able to get the skills and services needed to rise above the situation they're in when they first enter a center. In many cases, what they need most is a friend, someone to stand by them and tell them, you can do this. You can choose life for your baby and fulfill your dreams, and I'll help. Studies have shown that 80% of women who've aborted admit after the fact that if one person had come forward and said, you don't have to have an abortion, I'll help you, they would not have made a choice for abortion. The Abortion Alternative Program, operated by nonprofits, evaluates the total person and meets her where she is. Whatever support she needs, she gets.
Most women want to feed their baby. They want to know, can I clothe my child? Can I feed my baby? And if resources are in place to encourage that woman, it makes all the difference.